The measles outbreak continues to spread across the U.S. The Centers for Disease Control and Prevention is reporting 102 cases. CBS News has learned that there are now at least 155 reported cases in 16 states. The latest is at a daycare facility in Illinois. Here with more is CBS News contributor Dr. Holly Phillips. Holly, good morning.
Good morning, Anthony.
At a KinderCare Learning Center in Illinois, 5 infants were diagnosed with the disease. So far, 2 of the cases are confirmed. When will the other parents know what's the case with their kids?
You know, one of the things that makes measles such a tricky disease is that it has a long incubation period.
Yeah.
It can be 21 days after you're exposed before you even develop symptoms. The average is about 14 days. Also, you're most contagious 4 days before you get the telltale rash, and 4 days after that. So you might be spreading the illness without even knowing. The parents might not know for a while. The kids are being monitored. Well, really, the babies are being monitored at home, and they're being told to avoid anyone, of course, who hasn't been vaccinated.
In all this coverage, it seems like they've linked everything to what happened at Disneyland. How do they know for sure it all came from there?
Sure. Many of the cases are being able to be linked. They do that in 2 ways. The first is called contact tracking, which is this really exhaustive process where they look at all of the contacts a person who has measles has had in the weeks leading up to it. It involves hundreds, sometimes thousands of people. But most of this is actually done in a lab, genetic analysis on viral samples. There are many different genotypes of measles, so they basically try and match each genotype with the one that's at Disneyland.
Holly, with a disease this contagious, how do we contain it?
You know, Anthony, it really only comes down to vaccination. The disease is so contagious. 90% of people who are unvaccinated in close contact with someone who has it will get it. Although we know vaccination works, in 2000, the disease was considered eliminated, and now we're seeing it rise again. But if we've done it once, we can get rid of it again.
All right, Dr. Holly Phillips, thanks so much.